Hello, my name's Nigel Rossiter and I'm the chair of the Primary Trauma Care Foundation, which I'm going to tell you a little bit about now. So trauma is a big global issue. It is what I call the forgotten pandemic. There are over 5 to 6 million trauma-related deaths per year, and that's more than all the contagious diseases added together, and that includes our present pandemic of COVID-19. So add COVID, HIV, TB and malaria together, they still don't come close to the numbers who die or are injured from trauma every year. Now, before COVID hit, the number of people who died from trauma was almost twice that as contagious diseases. And yet, contagious disease gets 36% of global healthcare funding, and trauma got only 1%. Since COVID, that spending on contagious disease has gone up to 60%, and the numbers still don't reach the same as injury, and spending on trauma care is now less than 1%. That's a problem. We know that most trauma in the world happens where most people live. Surprise, surprise. And you can see the population density here, that Southeast Asia and China, plus areas of Africa and the Americas have an enormous population density. But what's the difference? Well, the difference is the people who live in those environments and the environments they actually live in, because everywhere is very different. In high-income countries, transport on vehicles like this, in this particular way, now is virtually unheard of. There's lots of legislation to prevent this. And that has been very effective. The deaths from road traffic incidents in high-income countries, as you can see, have fallen year on year for over the last 40 years. That is unfortunately not true in low-income countries. And if you look at these countries in Southeast Asia and Asia, you can see unfortunately deaths from road traffic incidents have increased year on year, and that is still the case. To give you an example, in Iran, there are just 1 million vehicles, but they have over 20,000 deaths per year due to vehicle-related trauma. In the UK, we have 32 million vehicles, and yet almost 7 times fewer deaths per year. So is there anything we can do? Well, the answer is yes, there is quite a lot we can do. I might refer you to this paper I've recently written called Trauma, the Forgotten Pandemic, which will outline all the problems around trauma care. And it essentially comes down to 6 main headings: prevention, pre and in-hospital care, secondary care, hospital care, rehabilitation, collecting data and changing political will. And primary trauma care comes into the second and third of those, the pre and initial hospital care and secondary care. So the primary trauma care course is a skills course that is traditionally taught using lectures, small group teaching, skill station scenarios, and multiple choice questions, going through what those of you who would be familiar with ATLS are very familiar with. The primary and secondary survey, looking at vital systems, talking about special situations, and then talking about disasters. But what's so special about PTC and why is it different from ATLS? Well, it's free. There's nominal or no charge to the participants, and we are what we call resource appropriate. We use what is available. We work within people's own skill levels, and we use local faculty and instructors so that we have appropriate people training. And we train people locally with immediate devolution and cascade. So how does it traditionally work? Well, traditionally we run what we call a 2-1-2 scenario. So I'm about to take PTC into our 84th country in Burundi. And what we hope to do is run a week where on the first 2 days, on the Monday and Tuesday, we'll bring in 20 participants, and with a visiting faculty from a neighbouring country, we will teach those 20 participants how to do PTC. During those first 2 days, 10 or 12 of those participants will be selected or pre-selected to attend day 3. And they will attend an instructor course, a training the trainers course, where they learn how to teach PTC And on day 4 and day 5, we bring in those 10 instructors then run another course on the following 2 days with 20 new participants, with the visiting and initiating faculty sitting in the background to ensure that we stay on course. And in that way, we hope that we've got 40 people trained in PTC with 10 new instructors, and we can cascade that out. Now, that is all very freely downloadable on our website, primarytraumacare.org. And we've recognized in the last 5 years or so that it's becoming increasingly difficult for people to get time to attend courses like that, whether it be for 1 day, 2 days, or for a whole week. And so you'll see in the bottom right that we've now made the course modular. And so there are 10 modules that could be run for 1 to 2 hours, and you could have a 1 to 2 hour session once a week over a 10 to 12 weeks and learn the whole course in a modular fashion. Traditionally, those have been lectures or small group discussions or scenario settings where we sit around and do all of that. But we all recognize that the world has changed in the last few years, and even before COVID hit, we were beginning to think about new ways of teaching, and COVID has made us all think differently. Now, one of my other hats is I have been the chair for AO Education previously in the UK, and we've started to do that digitally using common platforms, and we use Microsoft SharePoint. But you just need some way of sharing information, whether that be Dropbox or WeTransfer or whatever else you like. And we've also got very used to, in the last couple of years, talking to people digitally and online. It doesn't matter what platform you use, that's just an illustration of Zoom. But there are lots out there. And using those, we've become much more proficient at transferring videos for people to be able to look at digitally. So you can go on to platforms like YouTube and have a look at educational videos on how to do things. So in the last few years, I've been partnering with one of our faculty who is originally from Morocco, and PTC is about to go digital, and we're about to go digital online in Morocco, I hope this month, in French, using the For Better Health Academy digital platform. So watch this space. Now, the one thing that we haven't addressed just yet are the skill stations. And these are always the most popular bit on any course. So learning how to put in a chest drain or intubate a patient, do a cricothyroidotomy, put up fluid, cut downs, splinter pelvis. And it's always nice to physically get hands-on. Now, sometimes that's not going to be possible. And so we are working very hard to make these digitally available, either teach them live digitally or use simulation to do it. So watch this space. We've been in some interesting discussions with these organizations, and watch this space. I'll be able to fill you in more, I hope, very shortly. So the reason PTC has been successful is because we're so big now, we can use local instructors who use the local language, are culturally and ethnically appropriate to make the course popular. We use regular assessments of the people who attend the course, both before they start and when they finish. And we're running research projects to see if what we teach is continued and sustained and makes a difference to the national way of managing trauma victims. As I said, we're about to go into our 84th country. We're on every continent in the world except Antarctica. And we're a big organization. We now call ourselves really a movement. And as I said, everything that you would like to know about primary trauma care is on the website, primarytraumacare.org. But I might draw finally your attention to the last thing. We are a charity. We survive completely on the generosity of people who wish to download the stuff, making a donation. And I would really, really ask you to make a donation to the important work that we think we do. Thank you.